Hi, welcome to the EHR Usability tutorials. Today we're talking about user testing and how to set up your testing. As part of our previous discussion, we walked through the importance of user testing as both a formative means of assessing your system as well as a summative way of looking at what your final product does in terms of performance. When you select your participants to engage in user testing, you should really consider the fit of the tasks to the typical use of the system as it was intended. That is, when you're testing an EHR system and you have to decide who are going to be the participants in your summative test to see how well does the system actually perform against benchmarks you've set, or to figure out what the actual time is to complete tasks, those sorts of things. You want to make sure that you're asking your end users to complete things that would be part of their natural work when using the system in the real world. That is, you want to make sure that you're asking a doctor to complete tasks that a physician typically would, and that you're not asking people to move outside of their usual role or use of the system. You want to match participants for characteristics like their role, but you also want to consider and collect information about experience with this specific system or systems like it, experience with the clinical environment, experience with the format or the media that you're using. So if they're testing on an iPad, how often do they use an iPad? Those sorts of things. And typically for summative user testing and formative user testing, super users are traditionally not the best type of users to test because you're looking for more of a representative user to give you an idea of how your system will be generally used or thought of. When you're selecting the number of participants, particularly for summative safety enhanced design testing, NIST, as part of their protocols, has suggested 15 participants per group. Additionally, if you use a counterbalanced design where you have within subject participants, this can reduce the number of total people needed as you have different statistical abilities. When you're developing the task, or any kind of task, you have to decide what kind of cases are you going to use. For certification of EHR systems, the safety enhanced design use cases were provided specifically for those 8 types of cases. But in other summative tests, you might want to think about what kind of tasks to test based on frequency of use, criticality or centrality to the system, and those that users have previously reported as being troublesome. Those might all be ways of selecting which tasks to develop out as part of your user testing protocols. When you're creating your user testing experience, you have to develop out the entire experimental design, including the stimuli or the scenarios that your end users are going to be using as they walk through the system. Here we talk about developing out task scenarios. That is, if you have an end user, say a doctor or a nurse or a medical assistant, sit down with your system and you want to find out how hard is it for them to complete something like entering vital signs or completing an electronic prescription. You need to give them enough information so that when they're using the system and entering data into the system or pulling information from the system, that it gives them an appropriate and realistic use of the system. And so you have to provide contextual information to help them complete those tasks. This can include things like, when you're having them access a patient, have you given them enough information to verify that they're in the right place with the right patient? That is, did you give them names and birth dates? Do you have foils or distractors built into the system so that they actually could grab the wrong patient, so you could look for errors? Did they find the right patient? Did they confirm it? We also feel at Sharpsy that you need to provide narrative details for motivating the task so that they can then engage more fully with the system, but also have the task feel like real work. This can include things like prescribing drugs for a given condition so that they can then understand the alerts that pop up as they relate to pregnancy or renal failure or other things that make more sense of the scenario. We also suggest that you base the content based on representative data for your type of clinician, for your type of clinic, for the types of cases they're going to see there. And as part of our Sharpsy initiative, we've actually created these task scenarios for the 8 meaningful use cases. We did this by actually populating our scenarios with information and tasks that were from 2 large 100,000 patient databases so that the tasks would be appropriate. That is, when you're asked someone to e-prescribe a drug, well, how many drugs are commonly ordered during a visit? That sort of thing. Additionally, when you give the task to the participants, you need to give them clear enough information so that they know whether or not they're done or have they started the task. Additionally, when you're going to be reporting back things like time on task or the efficiency measures, you want to make sure that you have clear starting and end points, not only so that you can aggregate across your participants, but also so that you can compare appropriately to benchmarks. If you ask participants to enter an e-prescription, but you start them on the opening screen of the EHR where they log in, for one participant, and then for another participant you have them start when they're already on an add medication screen, you're going to have different times on tasks that have nothing to do with the use of the system and everything to do with where you started them. So you need to keep those things in mind. When you're presenting data to the participants, you also want to make sure that you're not creating unnecessary memory demands simply by asking them to do this extra task and keeping all this additional information in mind. So when we created our test scenarios, we made sure that it was set up so that they had a motivating narrative, bullet points for actions, and then a table that gave them the data that they needed to enter so that they could easily look over on a physical sheet of paper beside them and fill that data into the screen, not creating an additional burden of trying to remember all that information in addition to the complexity of working with the EHR itself. Additionally, when you're presenting data to the participants, you should really fill out all of the information within the screen that they're going to see. So complete patient banners, have the side panels filled out with relevant information, create enough back history on a participant so that when they're filling out a prescription, if they want to confirm what's the pregnancy status of this young woman or what other drugs might they be on, that information is available for them because that would be part of their typical workflow. And that's what you want to test as part of summative testing would be, how does the system function in a typical fashion? Here's an example from one of the scenarios that we created at the Sharpsy for medication lists. As you can see at the top, we have a narrative that helps the participant understand that they're looking for a patient who came in, she's got these prescriptions, and here's what you're being asked to do. As I stated earlier, we have bullet points that again mark out the specific tasks without being prescriptive. We're not telling them where or how to do things, but generally what are the tasks they're trying to accomplish. And then we provide a table of the information for data entry so that they don't have to recall what exactly off the top of their head was that dosage of Lipitor. Again, this is not prescriptive. As you can see, we're saying navigate to the list and verbally state the name and strength. We're not saying click on this tab here, click again, click OK, those sorts of things. We're not walking them through step by step. We want to capture their use of the system, but we want to guide them enough so that they know where a task begins and where a task ends.